I'd like to introduce Group Captain Alex Bennett, who is the Defence Professor of Rehabilitation Medicine and Consultant Rehabilitation Physician, who's just given us a fascinating talk on the ADVANCE study looking at the long-term outcomes of combat casualties from the Afghanistan war. Group Captain, welcome. Hope you enjoyed the day. Couple of questions. Can you tell us about the ADVANCE study and its lessons, particularly for the civilian?
Absolutely. So the ADVANCE study, as you mentioned, is a long-term outcome study. It's unique. It's the only one in the world. Not even the Americans are doing it, and I think probably because of the geography of the US.
Yes.
And we're looking at multiple outcomes. And one of the beauties of a cohort study, we can look at a lot of medical outcomes and psychosocial outcomes. We're looking at a cohort of 1,200 people over a 20-year period from injury. 600 are injured, 600 are comparison group. And we're looking at cardiovascular, musculoskeletal in terms of osteoarthritis, osteoporosis. We're looking at mental health, looking at pain. We're looking at, from a psychosocial perspective, as I said, mental health and relationships and occupation and the use of alcohol, drugs as well. So a broad range of different outcomes. So far, we're kind of midway through. So we're collecting data at the moment from the 14-year point, but we haven't analysed that. So that's 14 years from injury. We've got the 11-year data, but we're working through that. So most of our data at the moment is from 8 years from injury. And what we're finding from that, and we think as my collaborators, that the research we're doing, although it's combat trauma, it has a generalizability to civilian major trauma. There may be some things that aren't true in there, but overall, we think, if you have sick, it's about the severity of your trauma, not necessarily the mechanisms. And therefore, I think most of what we're finding is very, very relevant. So what we're finding in this major trauma group, albeit combat trauma, is that there's signals for increased cardiovascular risk quite early on. And this is 8 years. It's not a clinical cardiovascular risk, but there's risk factors that increased. We're looking at early osteoarthritis. We're looking at early, particularly amputees, early loss of bone mineral density, particularly around the amputated side. We're looking at a variety of different mental health outcomes, which I think could be unique to the military, but also could be generalizable to major trauma, because clearly it's traumatic. So a number of different things is coming through at the moment. And I think I can't give you anything really definitive at the moment, but we're well on the way to getting 14, 20-year data. And I think, as bearing in mind this is a young cohort, I think that the data will become clearer as that goes on.
And you've had some really interesting findings so far. And as you say, they're young. They're so much younger than most of our rehabilitation patients. As you also said, now most of those personnel are veterans. They are in the civilian world, and they've gone back to the communities that they grew up in and came from. Are there any other particular points you'd like to make about military personnel who are now living in and cared for by civilian medics?
So it's a very good question. Clearly, I can only say it from where I stand. I would say that our cohort or military patients, they can be wonderful patients to treat. They really can-do attitudes towards their rehabilitation. That might be partly towards their age, partly because of their background in the military, but they want to do things, and you tell them to do things, they generally do it. And they want to. They're not afraid of failure. They're not afraid to really commit to doing something. I think on the flip side, you do have to be conscious of the fact that some of them have had some very complex histories and very traumatic from a psychological perspective. So that can make the patients quite a bit more challenging to manage because of the complex mental health backgrounds that some of them have. Not all of them, some of them. So I think just be aware of potentially what they've been through in the past, and kind of put yourself in their shoes when managing the long term. But generally speaking, I think they're a very nice group of patients to treat.
that's been my experience from a purely civilian perspective. I've always enjoyed treating them, but there are a lot of nuances. So that's really interesting and really important for us. And just finally, where can people find out about your study? You mentioned some of the results
yeah,
online.
absolutely. So the Advanced Study has a website, so the advancedstudydmrc.org, and then actually we will have all our data discoverable on there. Many of our papers are published on there. Please have a look, and we're always open to ideas for other future research questions as well.
Brilliant. Thanks very much for your time.
Pleasure. Thanks.
Thanks.